Okay. Okay, guys, how are we doing?
Kate, can you see mine?
Say who is this again?
Kelly from K2.
Kelly, you appear to be okay.
Mine says, please ask the host to give you permission.
Yeah, so does Pat's.
Yeah, that's interesting. It's saying allow.
And Galen.
Sorry, guys. I don't know what's going on with Zoom. Looks like we might have to just share our file with you right after this. So I will do.
Can I go out and come back in and we'll just give it one more try?
Sure.
Sorry.
Thanks for your patience, everybody. So watch for Ted. Julie, do you want to work on that while we get things started?
Yes, let's go ahead and get started.
So just chat with Julie if anybody still needs help, and we will we'll work. We'll just get started. So thank you for joining us. I'm here today with Chair Deborah Kafori, Health Officer Dr. Jennifer Vines, Dr. Renee Edwards, the Chief Medical Officer of OHSU Health, Dr. Mary Giswold, Associate Medical Director for Northwest Permanente, Dr. Seth Podolsk, Chief Medical Officer at Legacy Health, Dr. Kevin Olson, Chief Executive for Clinical Programs at Providence, Portland Public Schools Superintendent Guadalupe Guerrero, and State Representative Dr. Maxine Dexter. Our speakers are going to say a few words and then we'll turn it over to your questions. And then we just ask reporters to put their names in the chat so that we can take your requests in order. With that, I will mute myself and ask speakers who aren't speaking to just take off their video until they're up.
Good afternoon, everyone. Thank you so much for joining us on this call today. I'm Deborah Kafori, your Multnomah County Chair, and I'm grateful to be joined today by the truly impressive healthcare leaders who have steered our collective fight against COVID-19, from our own Multnomah County Health Officer, Dr. Jennifer Vines, to leaders from the 4 major regional health systems who have been on the front lines during our darkest days. Doctors Edwards, Giswold, Podolsk, and Olson, in addition to treating COVID, you have built a remarkable collaboration to vaccinate our community. And I'm also honored to be joined by an educator and a state lawmaker, Superintendent Guerrero and Representative Dexter, both incredible partners who have worked tirelessly, sometimes thanklessly, to help our families and our community endure the immense challenges of the COVID-19 pandemic. While they've all seen firsthand the harms, disruption, and pain that so many have experienced over the last year and a half, our collaborators have also had a central role in helping our community make great progress against the virus. But with the emergence of the Delta variant, we are at risk of losing the gains that we've made together, which is why we've called this conference today. Today, I'm announcing an executive order that requires everyone 5 years of age or older to wear a face covering in all indoor public spaces, regardless of whether they have been vaccinated or not. This is in effect on Friday, August the 13th, and it will be enforced. We'll enforce this mandate like we do our tobacco regulations. The process will be complaint driven and will involve a series of escalating steps from education on up to a $1,000 fine. And we'll be sharing more of that process later this week for the public to report issues either online or over the phone. Why are we taking this difficult step now? It's because we know that masks work. They are tried and true, they are affordable, and they're an effective way to limit the spread of this virus and its variants. And until enough of us are vaccinated all across Multnomah County, masks remain one of the best strategies that we have to keep each other as safe as possible. This executive order builds off Multnomah County Public Health's late July recommendation, which we made as we began to see a resurgence of COVID-19 cases fueled by more social activities and most notably by the Delta variant, which we know is much more transmissible. The variant has undeniably changed the terms of our engagement with this pandemic. This executive order represents an urgent, necessary pivot in what we can and must do as a community to slow the spread and save lives while we continue to get our community vaccinated. We've heard from many members of our community who have expressed support for the clarity, gravity, and the enforcement of a mandate. Today's action brings consistency to expectations and minimizes confusion in the public indoor spaces across our county. But more importantly, it is a measure that we must take to protect each other, all of us, from a variant that is ripping through communities. It's a step we have to take to keep our kids safe, especially those who are too young to be vaccinated, as well as their teachers, as we get ready to send children back into classrooms next month. It's about keeping community members who remain vulnerable, including those who have not yet been vaccinated, protected as much as possible from severe illness that requires hospitalization, and in the process, making sure that our hospitals have the capacity to help people experiencing other life-threatening circumstances. It's about protecting frontline workers, our family members, neighbors, and friends who perform work that is essential to keeping our community moving. We know that the widespread use of face coverings can and does work to bring cases down. But I want to be clear, the best, most effective step that people can take to protect themselves and to protect each other is to get fully vaccinated. The vaccine is safe and it works as it should. It prevents severe illness, hospitalizations, and death. And I also want to note that Multnomah County will be implementing the state of Oregon's vaccine mandate for healthcare workers to be vaccinated or to undergo weekly testing. Many of our employees, both in healthcare and elsewhere in our county, are fully immunized. And with that, I'll also want to note that I've asked the governor to broaden that mandate to include people who work in corrections and law enforcement. We are at a critical juncture in a pandemic shaped by community-altering moments. We have the tools, vaccines and masks, and we have the science to fight back against the surge. So it's up to all of us to lean in again and even further into our sense of connection and our concern for each other, to muster up the tools, muster up the will to use these tools and recover the progress that we had been making before this variant. And with that, I will turn it over to Multnomah County Health Officer, Dr. Jennifer Vines.
Good afternoon, everybody. This is Jennifer Vines, the Multnomah County Health Officer. Thank you, Chair Kafori, for your leadership throughout this pandemic, and special thanks to our partners who are joining us here today. I'll just offer some brief remarks specifically about the Delta variant and just to be very clear on where we find ourselves today. So this is a version of the COVID-19 virus that emerged earlier elsewhere on the globe and has made its way to Oregon as we expected it would. It was expected to be the dominant strain locally by August, and that has in fact turned out to be true. It is more contagious, up to 3 times more contagious, and there's some early evidence that it may cause more severe disease. And unfortunately, some of that disease is manifesting in younger people who have yet to be vaccinated. I want to be really clear that the vaccine is outstanding. It has a tremendous safety record. It does its job in preventing severe disease and hospitalization, but we're learning that in the setting of the Delta variant, it will not prevent all infections. So a vaccinated person may still get a mild infection and therefore may still be contagious, which is why we're asking everyone now to wear a mask indoors in order to slow the spread. We're hoping to slow the steep curve that we're on, a curve that was at about 100 cases in Multnomah County in mid-July and is approaching 1,000 cases a week. I should say 100 cases per week in mid-July and approaching 1,000 cases per week as of early August. That's an order of magnitude. We want to be entering the fall, the respiratory season, the school year in better shape than we're in now with respect to our hospitals, families' confidence in returning their kids to schools, and keeping our businesses on the roads to recovery. I want to be clear that we are not trying to prevent every case of COVID-19. That's not possible. It's not realistic. We need to slow the spread with the tools we have, which right now are vaccine and masks. And I want to thank again the partners who are here today and hear more from our health systems by turning it over to Dr. Renee Edwards.
Thank you, Dr. Vines. I've been here many times asking for your help. And as everyone has said so far, frankly, we need your help now, really more than ever. Our hospitals are finding themselves at their fullest capacity, and we will rapidly reach beyond the tipping point if we don't act immediately. And tragically, if we don't do something today, more people will die because we will not be able to serve the Oregonians who need hospital care for COVID-19 and other urgent healthcare conditions like heart attacks and strokes. This is because the Delta variant is indeed spreading throughout Oregon, just like the wildfires that are ravaging our landscapes. Vaccinated people can get the virus and spread it, but you are much less likely to become severely ill or die from the virus. Getting vaccinated is the single best thing you can do over the long term. Protect your health and protect your neighbors and friends. But wearing a mask beginning now provides the immediate protection that Oregon needs. And I want to tell you that you can make a big difference if you wear a mask, whether you're vaccinated or not. If you're not vaccinated, I would ask that you limit your activity as much as possible because you are putting yourself and others at significant risk. I also want to take a minute to address the kids in our community who are not yet able to get vaccinated. Unvaccinated people are spreading the virus to our children. And even though kids are not as likely to get severely sick or die, we just don't want them to get the virus because it can still potentially impact their health. And we don't know yet about the long-term impacts of having had the Delta variant or COVID-19. I want to note that our immunity level as a state, when considering previous infections and the number of Oregonians vaccinated, actually makes us the 6th highest risk in the nation for new infections. And this is very troubling as we battle this Delta variant surge. But if we all mask now, we will lower the number of people who need to be hospitalized, and that will give those who still need to be vaccinated time to get their immunity through vaccination. We need less Oregonians to need our hospitals for COVID-19 so that we can help your family and community members that need us for a car accident or a heart attack or a stroke. Please don't think of masking and personally distancing as a closed Oregon, but instead think of it as keeping our hospitals open for our patients and limiting the spread of the virus so that our schools can be open for our kids. Now, many of you are hearing this news and wondering what to do, and we know what to do. To limit your risk of getting this highly contagious COVID-19 Delta variant, our experts recommend following at least 2 of these 3 precautions, whether you're vaccinated or not. Wear your mask, always indoors, but also outdoors in group gatherings where vaccine status is unknown. If you need to gather, do it outside. It is safer than inside gatherings, and physically distance whenever possible. OHSU stands by Multnomah County's mask mandate. OHSU believes the entire state should be masking. I recognize this is being decided at a local level, but every community's actions will lead to consequences at a state and even a global level. Every mask matters. Every vaccine matters. Every choice you make to avoid crowds and avoid being indoors unprotected matters. OHSU is Oregon's academic health center and serves the entire state. We stand here with Multnomah County and our colleagues at the metro area hospitals, but are asking every county in Oregon to consider mandating masks and recommends physically distancing whenever possible, especially when in groups without clear vaccination rates. Oregon has successfully stemmed this tide before, and I'm truly sorry that we're asking you to do it again, but it really must be done. Please protect yourselves and those who cannot protect themselves with the safe and effective COVID-19 vaccine, including children younger than 12 and the immunosuppressed in our communities. Please get a vaccine, wear a mask, be safe. Thank you. And now I'd like to turn it over to Dr. Mary Giswold, the Associate Medical Director of Hospital and Post-Acute Care for Northwest Permanente.
Thank you, Renee. Our hospitals at KP are very full, and we have long waits in the emergency rooms. Our staff in our hospitals are weary, they are tired. These days, we often have patients waiting in the emergency department for long periods of time to get an inpatient bed. And we are having regular conversations about having to cancel surgery and procedures. We do not want to delay care for people in the community. For the safety of our staff and our patients, we are going to be further limiting visitors in our hospitals to help reduce the transmission of COVID-19 to our patients and our staff. As COVID cases increase, the virus has more opportunity to turn into a more dangerous variant, which can be even more transmissible and less responsive to vaccines. The pandemic is not over. Please encourage your family members, your friends, co-workers to get vaccinated and to wear masks. Please get tested and isolate if you have symptoms. We are not through this yet, and vaccines and masking are necessary to end the pandemic so that we can get back to lives as we previously knew them. Thank you very much. And now I'd like to turn it over to Dr. Podolsk from the CMO of Legacy Health System.
Well, thank you, Dr. Giswold, and thank you to the entire community for inviting me here today to represent Legacy Health. This terrible global pandemic continues to challenge our health systems and those we serve. And just as you heard from my colleagues before, we too are at critical census and asking for public help. As a parent, a community member, and an emergency physician, I'm grateful for the incredible work that has been done by all. I also want to share what I'm hearing from colleagues at the bedside, in the emergency department, the intensive care unit, and the general medical surgical floors. Delta is different. There are more infections, sicker patients, and higher transmissibility. And at the bedside, these incredibly sick patients, minutes away from needing a ventilator, are remorseful that they were not vaccinated. They're clamoring and asking our caregivers if they can now receive one. And it is the message when we heal them that they want us to share with our community members who have not yet received a vaccine. Together, we can beat this terrible virus. And Legacy Health stands behind all initiatives that save lives. Vaccines and masks save lives. Social distancing saves lives. So please protect one another and follow these guidelines. And we appreciate the support from Multnomah County and others. Thank you for your help in protecting your neighbors, your loved ones, and all of our community members together. Thank you. I'd now like to turn this over to Dr. Olson from Providence Health.
Thank you. I'm not sure I have a lot more to add than what's already been eloquently added from our other hospital partners, except to validate that these same trends are occurring in our Providence hospitals. We too are struggling with the ability to find enough staff to take care of the folks that are coming to us for care. The surge of cases in COVID is creating tension amongst our staff as to our ability to take care of the non-COVID patients. The ED waits that were just described by Dr. Podolsk were very much a problem for our Providence system as well. We have seen over and over again that with this pandemic, that when we use these public health tools, they do reduce the strain on the hospital systems. And at Providence, we too support the decision by the Multnomah County leadership to pursue the masking. And we've also, with our healthcare partners, would like to see the social distancing and vaccination efforts improved in order to protect the care of our patients and our staff and our population in general. And so with that, I'd like to turn it over to our public Portland Public Schools Superintendent Guadalupe Guerrero to speak to the issues in the school system.
Good afternoon. As superintendent of Portland Public Schools, responsible for nearly 50,000 students and close to 9,000 employees, I want to start off by thanking Chair Deborah Kafori for today's action and an announcement to require all people across Multnomah County to wear masks while indoors. I believe this action, one guided by public health experts, is an assertive step we can all take to step up our community effort to protect the children, youth, and families of our county. As leader of the largest school district in the state of Oregon, I'm proud of how our teachers, staff, school, and district leaders have adapted time after time to the dynamic nature of this pandemic. We have made incredible pivots in how we deliver instruction. We have done our best to fulfill our core mission of educating students. We've maintained a focus on providing a continuity of learning while attending to our children's social emotional needs. We've worked to adopt and implement every measure possible to protect the health and safety of our students and families. And as one of the region's largest employers, that of our dedicated employees and many community partners. And as educators by profession, from the very beginning, we have said we would be guided by public health experts, not politics, not the loudest expressed perspectives, not popular opinion. Today's decision by Chair Kafori is yet another example where collectively, as a community and a broader ecosystem, we're being guided by our public health experts and making the best possible decisions to prevent the further spread of COVID across the county. On September 1st, Portland Public Schools will fully reopen our schools, with our students receiving in-person instruction 5 days a week. And while indoors, everyone will continue to be required to wear masks in every PPS school and administrative building. In addition to requiring masks, we're implementing a set of health measures, including the continued promotion of the COVID-19 vaccine, 3 feet of physical distancing to the extent possible, increasing the effectiveness of ventilation and indoor air quality in schools, COVID-19 testing for symptomatic individuals, isolation and quarantine protocols, regular cleaning and disinfection, and regular hand washing. Measures that, when all layered together, protect against COVID-19. So now more than ever, it will be important for all of us to listen to the guidance of our public health experts and take the necessary steps to stay healthy and safe against COVID-19. Further curbing the spread of COVID will require all of us, not just schools, businesses, neighborhoods, and families, to do everything we can to protect one another and minimize any further disruptions to learning and all of our day-to-day activities. Let's all wear our masks for the benefit of our students and our entire community. We appreciate the ongoing support, firm guidance, and expert opinion from the Multnomah County Health Department as we prepare to welcome back students and staff back to in-person instruction. Thank you. And now it's my pleasure to introduce someone who I know shares our deep care and concern for children and families, State Representative Dr. Maxine Dexter, double agent.
Thank you, Superintendent Guerrero. First, thank you to the public health and medical professionals here today for your leadership and the innumerable essential workers who have heroically served on the front lines throughout this pandemic. I see you, and I'm grateful for your courage and dedication. Next, I commend and give my deep thanks to Chair Kafori for her leadership in reinstating universal indoor masking in Multnomah County. This decision today will save lives and will help prevent further infection and spread. While I come here today as a legislator, I'm also here as a physician. I have been on the front lines of this pandemic from the very beginning. I care for patients in intensive care units with COVID-19 pneumonia, and like all my colleagues who practice in critical care, have repeatedly seen the tragedy of lives unnecessarily lost. These deaths feel very personal to those of us caring for people every day, and its unrelenting persistence is taking a tremendous toll on our healthcare community. Over the past year and a half, it's been everyone's collective sacrifices that have saved thousands of lives across Oregon. Thank you to the millions of Oregonians who have made the decision to get vaccinated. More than 75% of adult Multnomah County residents have been vaccinated, and it remains the most important thing you can do to save lives. Since mid-June, the highly contagious Delta variant has changed the nature of Oregon's fight against COVID-19. Hospitalization rates and number of intubated patients, as you have heard, are rising. Tragically, the vast majority could have been prevented by being vaccinated. It is critical now more than ever that each of us does everything we can to prevent the spread of COVID-19. Unfortunately, due to the Delta variant, compulsory masking when indoors is again necessary to safeguard ourselves and our communities. Vaccination is the most potent tool in our kit for fighting this pandemic. However, masking is the most immediate step we can take to all together help stop the spread. Vaccination is free, safe, effective, and widely available. If you find yourself struggling with the decision to receive a vaccine, please understand your decision impacts not just your own health, but the health of others, the health of my children and yours. As a physician, I have had many conversations with my patients that have led to their accepting the vaccine despite significant concerns. It's important to take time to discuss your concerns with your trusted clinician. We all want to have these conversations with you. We have seen what this infection can do, and we care about you, keeping our patients safe. When I'm at the hospital and in clinic, my job is to care for my patients. As a legislator, my job is to care for my constituents in my state. It is my duty to leverage my expertise in the medical field to advocate for policies that will protect people. Policies like universal indoor masking. We are fortunate to live in a time of unparalleled scientific knowledge and discovery. As our understanding of how to combat this pandemic evolves, so must we. We as lawmakers must be willing to adapt our positions and our policies to the science with a common goal of preserving the safety and health of all. Today, that evidence shows we urgently need to mask back up. As we continue to navigate these unprecedented times, we need national, state, and local leaders to rise to the occasion, like leaders here today in Multnomah County, to follow the science and to implement and voice support for safety measures like masking and vaccines that keep communities safe from this deadly virus. Thank you.
Thank you, everyone. And if the speakers want to start their videos, and everybody can just jump on, I'll kind of change this format here so that it's in speaker view. And we've got a list of folks who would like to ask some questions. So off the bat, can I get a clarification? Is this the first county in the state to, AP is asking if this is mandate is the first county in the state to have a mask mandate?
And that is my understanding.
And to start off questions, we'll start with Pat Doris from KGW, and after that, Simon Gutierrez from KPTV. So Pat.
Thank you. Well, my big question, I think, is the heavy lift that you've all been talking about. I was in the grocery store earlier today, talked to a clerk about this mandate, and she shook her head and said, I don't think people are going to do it. So, Chair, are you really going to fine people $1,000? Are people going to be snapping pictures with their smartphones? How's this really going to work?
Thanks, Pat, for that question. I think, the reality is we're all tired of this virus and we're tired of wearing masks, but it is an easy and effective and immediate tool that we have available. We would rather not issue fines. We would rather not have people turn it into, self-policing their neighbors. But we want to be clear. Apparently, when we made the recommendation, the very strongly worded recommendation at the end of July, people didn't get the message. We need people to wear their masks indoors, regardless of whether they're vaccinated or not.
Okay, thank you.
Simon, do you want to?
Yeah, piggybacking off of that, you mentioned enforcement and the potential for fines. Is there a mechanism for that? Will this be through county public health? Will this be through some kind of a partnership with OSHA?
We are going to utilize a similar mechanism that we do with our tobacco and retail enforcement. And we will have the details of this released on Wednesday to the public when we release the official executive order, and the phone number and the email address that people can call in to report. Again, it is a last step. We will start with education, and that's why we're holding this press conference today, to alert people that is no longer just a recommendation. It's actually mandatory. When you enter in a public building indoors, you need to be wearing a mask whether or not you are vaccinated.
Just a quick follow-up, if I may. Have you reached out at all to the business community? Is there any kind of a buy-in from that standpoint? And we have the big box retailers, and there's different levels of acceptance for this. I think historically, what if anything have they said to you?
We've received a lot of feedback over the last month since the governor declared the state of Oregon was open again, and yet people saw the numbers increasing. Fear and confusion was, I would say, the dominant factors in our community. So we've heard from a lot of individual businesses, from a lot of business collaboratives, that having a clear, consistent, concise message is what is most important, and that it was very difficult for them to enforce these rules on their own. They wanted the state, preferably, but at least at the county level, to have a consistent message. So that's what we're doing today.
Lisa with Coin, Lisa Balick.
Yes, thank you. Chair Kafoury, what's the conversation been with the governor relative to asking for a statewide mask mandate to make this a lot, quote unquote, easier on counties?
I respect that the governor is in a difficult position with having 36 counties with varying levels of vaccination, varying levels of buy-in from elected officials, from businesses, and from community members. So I can say that she's well aware of what Multnomah County is doing and supports our efforts. And I would actually support other counties coming forward now that the governor has said that this is something that's going to be a county by county level. I would support, my sister counties around the state. It's not just Multnomah County that's dealing with the Delta variant. It's every county in our state.
Have you urged her to put back in the statewide mask mandate?
I have urged her to look at all the tools available to ensure that we can keep our community members safe.
But did you ask her specifically to put the statewide mandate back in?
No, I asked her, I told her that we were going to be doing it in Multnomah County and that we would like her support, and she said yes.
Thank you so much. Kellee, Kellee Azar-KAT K2.
Hi, yes, thank you for taking our questions today. My question has to do with the length of time this mandate is going to be in place. We're hearing that it could be up until January. What will you be looking for at that point, or even along the way, in order to hopefully at some point reverse this mandate or even extend it? What are you looking at, and what's kind of the benchmarks for us?
Yeah, so I'll take this question. Thanks, Kelly. This is Jennifer Vines, the Multnomah County Health Officer. We put an end date of January 2022 on this. That's to account for a few things. The first is, follows the typical respiratory season. We want to make sure our kids get back to school in a good start. I think as immunity increases, and we're going to need higher levels now that we have a more contagious COVID-19 virus circulating, but as immunity levels go up, hopefully through vaccination and not through infection, then we may be able to peel back this mandate before January. But I think this is an example of how we need to stay really flexible and really alert to how this virus is behaving globally and anticipating what we're going to need to put in place to keep our local communities healthy.
Thank you.
Rachel Monahan at Willamette Week.
Hi, thank you. This is a question for Chair Kafoury, and perhaps Yeah, we'll stick to Chair Kafori. Are you going to implement a mandate for other county workers who don't have an exemption under state law for a employee issued mandate, vaccine mandate?
So we are exploring all the options available to us at this time. I think, as you highlighted, there are some difficulties with a vaccine mandate at this time, even just as an employer, because so many of our employees are covered by the vaccine exemption. I have asked the governor to add other job classifications that are included in that mandate, or that exemption, to be removed. And I would like, assistance from the legislature to help make that possible. That being said, we know that there are other hurdles to address before that happens. And I'm really hopeful that this mask mandate will get us further towards our end goal of getting people vaccinated in the community through the safe, easy, effective, and free vaccines that are available in our community.
I just want to clarify one thing there. Are you saying you support repealing that 1989 law?
Yes, I do.
Thank you.
Julia Silverman at Portland.
Yeah, thank you so much. I have a similar question for Superintendent Guerrero. I am wondering if there's any conversation about vaccine mandates for school employees. And yes, and then I have a quick follow-up when you're done.
Thank you. That's a great question. What we know is that we widely promoted and made available the opportunity for not just our educators, but all of our district staff to get vaccinated. And the vast majority we know have gone ahead and taken that important step. We haven't made a decision about mandating it. There are probably some exceptions with employees who have some legitimate reasons for perhaps why they can't participate in taking the vaccine. But at this point in time, we haven't talked about a mandate for the adults in the system.
And will you be telling parents X percentage of teachers in your school or employees in your school are vaccinated? I understand you can't say specifically this teacher is, but will you be able to give parents an overall estimate? Because, I mean, correct me, one of the doctors, if I'm wrong, but we do know that vaccinated adults are the best way to protect unvaccinated kids, correct? Yes, lots of nods.
Yeah, I think that's right. We do know the percentage we would find to be very high across adults in the school system. There's been a significant uptake. We're talking with all of our labor groups around perhaps initiating a voluntary indication by our employees to try to survey who among us, what percentages can we offer some assurance have in fact taken the vaccine.
Julia, did you have a follow-up?
I did, if that's okay. I wanted to go back to the question that Dr. Vines answered. You talked about extending this through January, and perhaps if immunity increases before then, we might be able to roll it back sooner. Can you be any bit more specific on the metrics you might use, like 85% vaccinated, or if our hospitalization caseloads go down to, say, 5 per every 100,000 person? Any specificity on metrics?
I don't have a lot more specificity at this point. We are trying to define those thresholds because we understand it's important for people to understand, like, what is the milepost. I feel pretty confident in saying that I don't think this is forever. I do think that we're on a steep upward climb, and we really want people immune by virtue of vaccination and not by infection, because that's what's going to overload our hospitals and risk our recovery pathway for schools and businesses. So I don't have a specific benchmark for you, but it's something that we are trying to get a sense of so that people can see the results of their progress and their efforts.
Thanks so much. Ted Sickinger with the Oregonian. All you, Ted.
Yeah, I'm sorry about that. Thank you. I'm wondering if this situation is so dire, why not start this immediately? What good does this do if Washington and Clackamas County are not joining us? And 3, if this doesn't have the desired effect, and maybe there are different folks who would answer these, would you consider going back, or are you considering going back to more capacity limitations and other restrictions that were around earlier in the pandemic?
Can you remind us what the first question was, please?
Yeah, why not do this immediately? Why are we waiting till Friday? I mean,
Sure. Well, we know that it's going to take a while to get the word out. And again, that's why we're having this press conference today, because we want to ensure that before people start reporting businesses for violating these procedures, that we have had ample opportunity to get the word out. We will be distributing through our communications team flyers and collateral so that businesses will have the appropriate displays. And then just that there's time that people can get prepared for going back to something that we had in place earlier.
Okay. So what good does this do if Washington and Clackamas County are not joining us in this effort? And what, have you made a request that they do so?
I will ask one of the doctors to weigh in on what good this does here. I believe that I would love for Washington and Clackamas counties to join. We've been working very close throughout this pandemic. And I think that it is Multnomah County doing this as a first step. And I'd love to see my partners join.
Thank you.
Sure, I'll just, I was just going to jump in and just reiterate what Chair Kafoury said. I think this shows that we're serious. This provides a model for how other counties may consider a similar mandate. That said, we are responsible for our constituents, and you can see here the strong support for this step today. So we can't speak today for Washington and Clackamas counties, but we can at least be very clear on Multnomah County's stance as far as the moment that we're in right now.
Okay. So if this does not have the desired effect of stemming spread, at what point would you consider, further capacity limits or some of the other restrictions that were around earlier in the pandemic?
I think Dr. Vines talked about the metrics that we're still in development for. And we realize that we don't have all of the answers today, but we believe that this masking step is so important that announcing it immediately was the best line of defense at this moment. We're exploring all other options, and hopefully this will help us stem the tide. But if it doesn't, we are open to considering other options to save people's lives.
Thank you so much. Zach Morris, the Northwest PDX examiner.
Hi, good afternoon. This question is for the superintendent. Do you have a metric set or a certain case positivity rate where you would think about going back to CDL or hybrid study hall learning? And then I have a follow-up after that.
Sure. I don't see your face on the screen. It'd be good to know who's behind all those social media posts, but thanks for the question. Look, and I value, I understand that you have a particular perspective. The challenge for any leader is balancing the perspectives of 50,000 families and 9,000 employees. And as you heard me say earlier, making sure that we remain guided by our public health experts, many of whom that you see on the screen here. And so all along, you have seen us try to, be guided by some of those indicators that signal to us that we can move into another phase. And you've seen that throughout this pandemic as we've shifted our service delivery model from being completely distance learning to going into hybrid to saying to our families, and now here's a further choice we can offer. And what we have heard is loud and clear, our parents want their students back in school. And for those who can't, or for whatever reason, want to exercise a different choice, we've also gone through a pretty heavy lift of making sure we offer a virtual school option for those that are interested. And surprisingly, actually, there hasn't been a large interest, but we're going to try to get everybody who wants that option there. As far as metrics for when we may need to pivot again and adapt, that's largely going to depend on our public health experts, many of whom are on the screen. And we're going to continue to be mindful of guidance from the Oregon Department of Ed. We're trying to follow the resiliency framework that they've updated to the letter. I think PPS will be an exemplar of that, and we'll continue to deliberate any whatever guidance comes our way, and to see if any shifts make sense. My hope, I'll want to remain optimistic, is that if we all adopt these safety measures, that things will improve.
Fingers crossed. A follow-up question. School sports will be starting in the next few weeks for Portland Public Schools indoor and outdoor sports. For indoor sports, will masks be mandated or required while a kid is in a gym? Some high schools still do not have air conditioning where the temperatures could be over 100 degrees. Is that safe for a kid to be wearing a mask while playing a sport? Thank you for your time.
Well, school district leaders are certainly working with OSAA, who sort of regulates athletics across school systems. We have received their initial guidance around masks to be worn. In some cases during competition, that could present a hazard, strangulation during wrestling. It's kind of hard to wear your mask during swimming, things like that. But I think wherever possible, when students are not competing, we'll ask them to wear their masks as they have been doing.
Thanks so much. We've got time for one more question. Erin Ross with OPB.
Hi, my question is for Superintendent Guerrero. Is there anywhere that we can find information on the progress that has been made so far at increasing ventilation in schools? That's been a continuing issue since the pandemic began, but it's been very unclear what progress has been made and what steps there still are to be taken.
Sure. What the community can continue to expect on an almost daily basis, information very transparently and to great detail is being posted on our website. Already over the last year and a half, there have been a great deal of improvements to try to maximize ventilation and air quality. That includes maintaining our HVAC systems on all the time, changing out filters to higher quality MERV or HVAC or HEPA quality. We've installed industrial strength HEPA filters in every single learning space across the school system. So we're pretty confident that the air quality is better than it's ever been. And we're continuing, and that includes other measures, keeping windows open, doors open, et cetera, to try to keep the airflow as optimal as possible. On our Back to School 2021, you will notice for each of our layered health and safety measures, details about what that looks in practical ways at our school site, as well as links to all of our standard operating protocols. And you can find many of the details related to each of these measures there.
And do you believe that that with those measures, 3 feet of physical distancing for a full capacity school will be enough to prevent transmission among students, even given the transmissibility of the Delta variant?
Well, I think we're all relying on our public health experts, CDC, APA, our American Pediatrics, but ODE saying that schools, the guidance and the recommendation is to try to maintain that 3 foot of physical distancing, and that's what we're doing wherever possible.
Thank you.
I want to thank everyone for joining us today. And just as a little side note, I just got a text from my hairdresser who said, as a small business owner, I want to thank you for this new mask mandate. So businesses are appreciative of our direction and guidance. And then if you have other questions or comments, please reach out to Kate or to Julie, and they will connect you with any of the speakers from today's press conference. Thank you so much. Stay healthy and stay safe.